Hi, I'm Kristen Palmer. Thanks for joining me for Pinehurst Living. I'm joined by Soli Griffin, and we are at Pinehurst Radiology. Lots of you familiar with the location on Memorial Drive here in Pinehurst. And boy, this clinic has been in servicing this community for many years now, about 30.
Yes.
Hard to believe, and you've been here for 13.
Yes.
I've known you in this community for quite some time. Our children have gone to school together and played sports together, and you and your husband moved here many years ago because of the community.
Right. We went to medical school together and trained together. We went all over the United States in our training, and we were looking for jobs. This area became available, and we both liked it, and we've been happy here for 13 years now.
Now, many folks in the Pinehurst and surrounding areas have come to Pinehurst Radiology for many different services in the past because, of course, it's been open for 30 years. But what are some of the new things, Soli, that people will find when they come here now?
Well, our main renovation this year and our main addition has been digital mammography. We converted from film screen mammography to digital mammography. The main advantage of digital has been shown. The studies recently came out in the radiology literature showing that digital mammography detected cancer earlier in a certain subset of women. And so there's been a big push in the radiology community to provide digital mammography.
Now, when you talk about those subsets, I know when I was reading the literature, women under 51, and there's some other...
Women under 50, women that are perimenopausal, meaning around menopause or premenopausal, and women with dense breast. The reason digital is good for women with dense breast is that when you acquire a mammogram, the patient will acquire her mammogram the same way. She won't notice a difference in the equipment or the way the machine looks, but the information that's acquired on the unit goes to a workstation, a reading workstation. Just like a camera in the past used to put images on a piece of paper, now with digital you can look at it on your computer. Well, this is the same type of thing. We're looking at it on a computer screen. And so we can manipulate the data and we can look at the images. And so women with dense breasts, which for us was hard to read because it was hard to detect abnormalities, since the workstation lets us see images and see abnormalities better.
And that's great, because that's the whole fight is early detection. Now, for the women who are accustomed to coming for their mammograms, that's great, and having that technical information, super, and the extreme benefits from having that. However, the woman who might be sitting out there right now and has not gone to the doctor for a while, has not ever had a mammogram, maybe had a mammogram 5 years ago, what would you say to that? It really is very easy to come here, and it's not scary at all.
Right. We've tried to make it, when we renovated this area, try to make it as private as possible, as comfortable as possible. The office is easy to walk into, and you don't have to be looking for a parking place or a big, office building or a big hospital. You're trying to find where to go. You walk in our front door, and our scheduling people are right there, and so it's a low-stress environment. And as far as the mammogram itself, we have technologists that have been doing mammography for many years. Some of our technologists have been with us for more than 10 years, so they're used to positioning the patient well, making them as comfortable as possible, and that's important for the radiologists as well, as to have patients be comfortable so that the technologists can get good positioning so that we can detect cancers.
Absolutely, and you do need to get a doctor referral, but one of the important things to remember, Soli, is if Pinehurst Radiology is the place you want to come, you are welcome to do that.
Right. We to schedule a mammogram, you just need to have a doctor's order, and you have to get it scheduled. You have to call and make an appointment. But yeah, we want to tell people that they're used to coming here, they like the technologist, they're used to the location, they can ask their doctor to come here.
It's just like any other service that you get. You get familiar with one person or a group that you visit, you kind of want to be able to come back to that same place.
And we've also we've added hours from 5 to 7 for people that work. Some other people say, well, I work too hard, I can't get out during the day. So Monday through Thursday we have 5 to 7 hours where people can come after work if they want to.
I'm sure that you hear all the excuses from women, not necessarily wanting to go get a mammogram or go to the doctor. As you mentioned to me before we were talking earlier today, women can get scared of what result they may find, but the early detection is so important.
Right. There have been studies showing that the mortality decreases by 40% depending on how people that are detected their cancer earlier, and there's a lot more options for people with breast cancer today than there used to be, so that survival rates have improved because there are more options out there for patients.
And it's fascinating to read, though, that about 40% of women still possibly not getting mammograms.
Right. It's a pretty high number because people are scared to come. But again, early detection, that is the what you want to do with mammography.
Well, as we were joking before, I'm a little over 40 and I've had a couple myself, and boy, it's easy, as you said, getting in and out, and very low key, very private, and not something to be fearful.
And we also want to stress self-breast exam, and people still need to go see their doctor and get their yearly appointments and yearly breast exam by their physician.
Okay, I want to also touch on the fact that you also have ultrasound here and x-ray.
Ultrasound we do on men and women, and not just breast ultrasound. We do total body ultrasound. We provide a full spectrum of ultrasound. And it is nice having ultrasound equipment in the office, because if a woman comes in with a palpable abnormality in her breast, or if there's a question on the mammogram that we want to look at a little bit better, we have the ultrasound equipment right here, and the patient can get her mammogram and go straight to ultrasound and get it all done on the same day. And that way we're able to read out the study and provide interpretation the same day.
Okay, well, that is all great to know. It's Pinehurst Radiology in Pinehurst. If you're at your doctor and you have a choice to make and you want to go to Pinehurst Radiology, it's here on Memorial Drive, and you can come and see Soli and many of the technicians and physicians that have been here many years servicing our area. Thanks for joining me today, Soli.
Thanks, Kristen.